Everyone loves the aesthetics and beauty industry, but you never get to see everything behind the scenes. It's for authorized personnel only. But now, you're being authorized.
We are in the operating room today.
Blow the dice for me. Put your pretty ass lips together, blow real nice for me. Yeah, I'm trying to hit a lip and slide to the dealership in the morning. Wow, Papa need a brand new story. Hot head, they not gonna believe it, but check the recording. Just that, up a few bags. Big booty hoes meet me in the penthouse. Bar full of liquor, cash for the strippers. It's gonna get weird tonight, so no, just put some money to blow. I'm about to buy Las Vegas after this road. I'm about to buy Las Vegas after this road. Come on, 777, let's go. Yes,
Hey guys, welcome to Naked Beauty Live. This is the Mother's Day edition. It's May. We just celebrated Mother's Day, and if you hadn't heard, we had a special contest for all the moms out there called Yo Mama. The Yo Mama contest was a huge success. We have a fantastic winner, and I'm not going to share it yet. The idea behind the contest was you nominate your mom, send us why you think she's fabulous, and then we chose from all the fabulous moms, we chose the one best entry, and she is pretty fabulous. So we're going to get to her in a little while. First thing we've got to do is get to the show. So as we get later in the show, we're going to introduce our winner, so stay tuned. And that winner won an amazing prize package. So let me get into the show. The show, since it's Mother's Day month, and we just celebrated Mother's Day, we're talking about mommy makeovers. Now, the term mommy makeover is a little bit confusing because people think, well, it's some kind of procedure that's called a mommy makeover. Well, no, there's no procedure called a mommy makeover, but it's a term that we have used for a number of years, a few decades now, that it describes anything having to do with tuning up a mom's body, and it typically refers to a combination of something doing with their tummy, like their body contour, and something for breasts. And it could be any combination of that. Now, the first tummy tuck was done in 1899, and since then there's been some great advancements in technique. We're going to talk a lot about the various advancements in tummy surgery, body contouring surgery, including liposuction and skin tightening, and then breast surgery. And we're talking, most of the time a mom has a baby, of course the tummy stretches out, the abdominal muscles separate. You get a condition called diastasis recti, which we'll talk about. And we want to make things flat, tight, firm, and get rid of the extra skin because you get stretched out, you come back, and then you have all this stuff hanging that you didn't have before. And most moms, they just want to get back to their pre-baby body. And when it comes to the breasts, well, they change quite a lot too. Not only does the stomach grow, the tummy grow and expand and stretch, well, the breasts do too. They get engorged, the breast glands get bigger, they stretch out the breast tissue, and then after they're done with the baby, after they're done with breastfeeding, if you breastfeed, all that glandular material shrinks. It atrophies, it shrinks down into, sometimes, and frequently actually, much smaller than it used to be. So you end up with a smaller, flatter breast than you had before the baby. You end up with kind of a stretched out, loose tummy that you didn't have before the baby. And, it's distressing. So you have your new little bundle of joy and a bundle of not so joy that comes along with the package. So we're going to talk about ways to make that better. And we're going to get started to do that with a very good friend of mine and world-renowned plastic surgeon. I want to introduce Dr. Aris Sterodemus. Dr. Sterodemus is, let's see if I get this right, he's a Greek, British, Brazilian, Arab, Qatari, American plastic surgeon and inventor. Did I miss anything, Aris? Welcome to Naked Beauty.
Thank you very much, Adam. It's a great pleasure to be here, and really, you said it all. And really, I like to congratulate you. It's a great show. I have been following that for quite a while, and I think we really it's a beautiful way of addressing all these needs of all the moms that they are out there. And whether they are American, they are Greeks, they are Brazilians or Qataris, they
Well, wherever
need
they are in the world,
this.
man, you've
Yeah,
got them covered.
they
You got
need
them covered.
absolutely everywhere we go, we're there. So they need this tuning clock after they give birth. So I think whether it's the breast, it's the body, it's the tummy, I think we got all the ways to solve all these postpartum problems. And I think, as you said before, if you would like to start with the breast, we got so many innovations, so many
Yeah.
things around for the
Yeah, well,
breast.
you in particular, you're doing quite a lot of cutting edge and innovative things, and you and I share a lot of technology in our practices. I'm always excited to see you at meetings and catch up and see what you're doing that's new because you really push the edge, and you're always thinking of new, better, modern, interesting, advanced ways to take care of things. So, let's get right to it. We start with the breast surgery, and typically for a mommy makeovers usually involve some kind of breast lift. Now, let's talk about the traditional breast lift, and then we're going to get to some of the kind of more exciting things that you're doing that are maybe without such an amount of surgery. So, thinking of a surgical breast lift, right? There's lots of different techniques. And at a minimum, if you're going to do a lift, you have to have a scar around the areola. There's got to be typically a real lift is going to have a scar that goes all the way around the areola. And the next step in my thinking is a lollipop. It would go around the areola and then a vertical line down like a lollipop. And that would be a fairly minimal amount of scarring. Sometimes you have to start incorporating a scar underneath the breast as well. But the old lifts, everybody was getting around the areola, the vertical line down, and a big old anchor-shaped thing. And it was a significant amount of scarring. But we do so much with less scarring now. What is your thought process when the patient comes for a breast lift, a surgical breast lift?
I mean, there are two parameters to put, Adam, as you know. First, the women that they go through breastfeeding, they lose volume. And at the same time, the breast sags because during pregnancy, it's getting bigger, and then obviously retracts as, they give birth. So we have to address two things, sagging and volume problems. So I personally like to discuss with any possible candidate first to see whether it's going to be an implant or fat grafting. As you know, we have pioneered a lot of procedures of fat grafting for the breast. And at the same time, like you said, I'm just going to sit down and speak with the patient to see what is the best type of scar that I would need to place in order to have a long lasting result. Because it's not about reducing the scars and then after a year, 2 years, the patient comes back and needs another breast surgery. So I always, go through all the options, all the types of scar, like you said, the lollipop around the areola, or even the classical inverted T mastopexy, which in some cases is needed. There's no way we can avoid these scars. So the patient needs to think that us surgeons, we want to give her the best result,
Of course.
the long-term results, and obviously we are going to do our best in order to reduce the scars. Nevertheless, there are some cases that they have to go all the way with the
Right.
inverted T. But even in those cases, the scars, we have so many different ways to make them look better in the long term. Even if everybody knows the scars, we do exactly the same thing, techniques, exactly the same sutures,
Yeah.
around the world. There are scars that they look perfect down, 8 to 12 months, and there are scars they're not going to look so good. So in that case, we're going to use some lasers, we're going to use some other techniques in order to get them there. So I think it's very important for the patient to trust their surgeon and sit down with their surgeon, see all the options, and obviously go with the best available for their case.
Well, I think, the way that I look at it is a lot of this has to do with um, a difference in the uh, the amount of sag. Like the more sag we have, the bigger the issue is, and the more sag you've got, then the more scarring you're going to have because we will need to uh, we'll need to add more skin removal. We need to get a bigger scarring involved. And again, volume is the thing, right? So when we look at a breast, we're looking at skin envelope, we're looking at volume, and we're looking at support. Right? Is it sagging? Is there too much skin, or is the problem that the skin is sagging? You can have a sagging breast that doesn't have too much excess skin. That's actually a pretty good situation if you're going to put an implant in. A lot of times you can just make that much better. Then if there's excess skin, well, you're going to have to take out some excess skin, and then volume becomes the issue. So, we all know that putting an implant in is a typical part of a lift. And you had talked a little bit about using fat. Now, here's the thing, and we're gonna get to that really special way that you're using fat. But before we do, because I don't want to mislead anybody, I get patients all the time that come in and say, well, I'd rather not use an implant. What about just using my own fat? Well, I don't think it works the same. I mean, I can tell you for sure it does not work the same. So, Aris, let's speak a little bit about, you have a fantastic technique for adding fat. But before we get to the technique specifically, tell me what your thoughts are on fat versus implant, because you can get great results, but where do you draw the line? How are you choosing one or another for your patient?
Excellent question, Adam. Fat is not going to give you projection. Fat is going to just give you volume. Projection is going to be given by the implant. So there are different kind of implants, as you know, and choosing the right implant for the right patient is going to do the trick. So if the patient walks in and says, "Doctor, I want to really, high riding, looking breast, upper fullness,
Right.
projection," then you definitely have to go with an implant. Or in a better way, you can go composite, or hybrid. And in
Right.
other words, is combining the implant with a little bit of camouflage by the fat.
Right.
I think this is
That's a great technique. There's that what you're calling a hybrid is something that, particularly in thin women that don't have that much tissue, smaller breasts, maybe someone that lost a bunch of weight after pregnancy, and just everything's floppy. You don't have a lot of tissue to cover the implant. Sometimes the implant is more visible. So in certain areas, like using it around the fold or in the cleavage area where you might have a more visible implant, in the upper pole where it looks a little bit too sharp and you're not getting that softer, beautiful, natural flow of tissue, adding a little bit of fat to those hard areas where you're seeing the things you don't want to see can make a big difference. So the thought of anticipating that and being able to do fat grafting with your implant, that makes a lot of sense.
I think that's, 90% of the cases now that I'm using implant for the patient, I'm just offering this camouflaging of the
Yeah.
implant. And, down the line, like in 6 months, the results are amazing. There are cases that you don't feel that the patient has an implant, although she's very thin. Another case that we need to put an implant is for thin patient, especially in Europe or in Latin America, like in Brazil, that I do operate. The patients are very thin, so you don't have a lot of fat to use in order to, augment the breast. So in that case, the only way to do it is by placing an implant. Now, let me just give you a little bit of hint. From my career that I've been in the last 25 years, I have found something very useful for the implants. The smaller the implant you choose, the less are the problems in the long term. Why is that? Because an implant is a device that sooner or later, due to gravity, is gonna, weight on the whole breast.
Right.
So if you think like, you have an envelope like the skin, and it's sagged, it has sagged because you gave birth, because you lost weight. When you put an implant in and you lift the breast, the smaller the implant, the less is going to be the chance in the future for the envelope, for the skin to sag again.
Now, what do you think about using mesh? This is in the United. Listen, Brazil has a different aesthetic, and is smaller implants, smaller everything. Even the idea of the Brazilian butt lift, they like smaller butts. Everything is more athletic, demure.
Exactly.
Not as big as we see in the United States. I'm in Miami, man. Where we
Correct.
are
I
seeing
know very well.
smaller, we're seeing smaller overall, but it's a relative term. I mean, the average
Right.
implant that I might put in
Right.
be 350, 375 cc's. In Brazil, it's probably 250.
Exactly. So there it comes the internal bra, which is a beautiful mess, like you said. And I do use it. Well, I do place 350 and 400 ml of implants in cases needed, especially from patients that they're visiting from the United States or even from Canada. And I can tell you, I say, my anesthesiologist just knows the moment I walk in the operating theater and I have 350s, 400, they say, are they North Americans? I say, you bet. So yes, in that case, we can use the internal bra, which is the mess, and I think it really, really makes the difference. So that's another beautiful, element that we have in our armamentarium in order to really secure. It's like an internal bra. I cannot explain it in a better way because it really supports the lower part of the implant and the breast. And in the long term, really, you don't feel it. So after 6 to 12 months, there's no way you are going to feel anything on the breast but the implant.
Well, I do like using the internal bra. Um, the internal bra, it gives it stability. I don't use it routinely. I have colleagues that they're putting it in every time because listen, there's an expense to it, and patients have to pay $2,000, $3,000 or more extra to use
So,
that. So I don't like using it routinely. I think if you're putting in an implant in that's maybe over 400 cc's, you can consider it. I think certainly I do a lot of revision surgery on breasts. Probably I do more secondary and tertiary cases where I'm fixing something than the primaries. And it's almost like a gift when I get a primary. It's like a vacation.
yeah,
They're so much nicer
yeah,
and easier. The tissue is great. But on the secondaries, where I'm fixing something, in those cases where the implant has kind of dropped down beneath the fold, that's something where I like to use the mesh to stabilize it afterwards because the recurrence of that is not insignificant. So putting a little mesh there is great. Sometimes the implant will fall off to the side, and you want to tighten the pocket, bring it back in, get it centered on the chest where it should be. A little bit of mesh on the outside. I just did a case, I don't know, a week ago maybe, where we did both. We put a piece of mesh on the outside, we put a piece of mesh underneath, and it really was like an internal bra, just cupping the implants. But I don't use that every time. I think it's great when you need it, but the thing is, a lot of people watching this and looking online, watching social media, they're going to hear internal bra, internal bra, internal bra, and they're going to think, oh, wherever I go, I got to get that internal bra. You can. There's no downside to it, really. I mean, other than you're putting a little bit of foreign material in your body that ultimately is going to absorb. But you just don't need to do that all the time. It's very useful when you need it for support. But look, think about it like a bra. Sometimes you just don't want to wear a bra. You can go. Your breasts are not going to fall down for the rest of your life if you're not wearing a bra. And some girls that have really perky, firm breasts, they don't wear a bra and regularly, and their breasts do fine. So you don't have to have it, but it definitely works.
exactly. And I would say revision surgeries, like you said, in most of the cases, I place, the internal bra because simply it's going to give you better support in the long run. But there are cases that we can get away, and this depends on the experience of the surgeon.
Sure.
Every case is different, as you know. But I'm really happy that you brought this up because there is a growing demand. Patients are coming to us, and because of the social media, like you said, the Instagram, the TikTok, they're asking for this. And as surgeons, I think we have to guide them through the right choice, not only for the implant, not only if they're going to use internal bra, what kind of scars they're going to place in order to lift the breast. But overall, what's going to be the best, you know, combination of all this in order to have, again, a nice long-term results. We are here, me, Adam, everybody who is a serious plastic surgeon wants to give really good results and
Right.
long-term results.
Exactly. The best long-term results and as safe as possible. Let's
Exactly.
let's get on to let's talk a little bit about your really exciting and special process for fat grafting. Let me lay a little background here. We've been using fat grafting for a long time. I mean, I use it just about every week, multiple times a week, many times. Uh, I don't do a facelift without doing some fat grafting. You do fat grafting to the breast and body on a regular basis, and it's all based upon the techniques that we've been using for many years. And the challenge with fat grafting is getting the fat to survive. Now, when we take fat and we're removing it from the body, we're taking away its blood supply. And there's a lot of different techniques in how you handle the fat. And as far as I'm concerned, all the literature has supported the idea that the less you handle the fat, the better it's going to do. So, really doing advanced processing techniques may not be helpful for it. However, there's also been a lot of work on stem cells and activating the fat and trying to enrich the fat. And people have tried this before. In the best case scenario that I've seen, up until recently, we can hope for, a textbook will tell you about 70% of take. And in the breast, where the blood supply is not as rich as in the face or in the butt, where you've got a lot of muscle around, it may be a little less than that. And the results show it. The results that we get typically in fat grafting to the breast, it's good for shape change. You can't really use it for significant volume expansion until now, maybe, because Dr. Stereodemus has come up with a way to enrich the fat in a two-step process that greatly increases the take of the fat, and the results show it. So tell me about the enriched fat grafting that you're doing.
It's we have been like for the last 20 years trying to get the best kind of results by, getting close to 100% of fat graft survival. When like 10 years ago, I stood in San Diego in a meeting of the American Society of Plastic Surgery, and I claimed that everybody was laughing. And I said, why, guys, are you laughing? Because they said, this is impossible. So the whole process that we are doing now is the patient walks in, we do a small liposuction of 100 ml under local anesthetic. We send it to the lab. The culture expand the adipose-derived stem cells. In other words, they multiply through a special process that we have, the adipose-derived stem cells. These are special superstar cells of your own body. And afterwards, we are just doing the liposuction and enriching these adipose-derived stem cells, these super cells, with the fat. At the end of the day, you're going to see results like the one we're going to show you, that we have 100% of fat graft survival. And it's all about the number and the viability of these superstar cells in your fat grafting. So if Adam, you can show some results, I think, one picture is better than 1,000 words.
Yeah, so we pulled a couple of cases, and you can see here. Here's one of your cases. This is amazing. First of all, this is using a different technique. You take a look at these breasts before, and they've got a little bit of sag. They're decent size. I mean, it's not like they're lacking volume, but the patient seems like wanted to be a little bit fuller. So take us through what you did. Now, I know that you used a technique we haven't talked about yet. We're going to get to that. Tell us, what'd you do for this patient?
I mean, we just took the fat out, sent it to the lab. The culture expanded. In other words, they multiply the adipose-derived stem cells, the special cells. And 2 weeks later, they gave it to us back in the operating theater. We did liposuction and enriched, so in other words, mixed the culture salts with the fat. And then we gave it back to the patient. It's exactly the same thing like you're doing in the United States for fat grafting, but you're missing the first part. So you haven't cultured the salts, the superstar salts that we are mixing.
Yeah, and so that really is kind of your secret sauce. The challenge that we've had is by to try and use uh, stem cells. We can't do that in the United States, and in fact, what we also cannot do is take out the fat and process it in any way before we put it back into the patient with any kind of chemical change. That's one of the limits of the stem cell research in this country, and until that changes, we really can't offer this process. But you're doing this in London, right? You're doing it I think you're doing it in Brazil.
In Brazil, in Qatar, in Europe, and in Asia. What you
Yeah.
can do now, it's the mechanical separation using the
Right.
lipocube. This is another, contribution that we have brought along some very good friends, and you are part of this. Um, Dr.
So we've
Jun Steriaki out
processed
of London
fat
and
into
Steve Cohen out of
microfat. Now
San
we're going
Diego.
to
And
emulsify
this has been
it. We
FDA
turn the
cleared. So it's the
filter
SVF cube.
so
So you
they're
can actually
facing
mechanically
the
separate
proper
and take some
ports.
of these cells
And we
out.
have to
But you cannot
emulsify
culture
by
expanding.
passing
So
it
you
through
cannot
about 10 times.
multiply these cells in big amounts. But nevertheless, you can get less amount of these cells. And obviously, you're going to benefit
Okay.
of this technique. You're going to get better results than just taking the fat out, decanting. So in other words, wash it or leave it there for the liquid to go out, and then you put it back in the breast. So for me, there are different kind of steps of processing. And I think in the United States currently, I'm going to be in Las Vegas and Los Angeles next week. We're going to be meeting, and after the meeting, I'll go and showcase a live case using not the culture expanding way we are doing in Europe or in Asia or in Brazil, but the black cube, the SVF, the lipocube,
Right.
in order to isolate these cells.
Right. Well, we're showing some video of the lipocube in action, and I use this thing on a regular basis. I have to tell you, you, Steve Cohen, Tunç Tiryaki, you deserve some kind of award for this thing because it makes fat grafting for surgeons. When I use this on every facelift. I use this on, I do a lot of hand rejuvenation now. I'm using it for all the hand rejuvenation to get some great microfat. This really makes it easy. Now, we could do this before. I've got filters that we can pass the fat through and process it manually, but this is so easy. It's a great tool to use. It makes my life easy. So thank you for that.
And
really makes a difference.
and Adam, let me just add something else. I mean, there are many devices out there that they claim to do the same, but I can tell you, independent studies done by several universities around the world, they found out that the lipocube produced better numbers and higher viability of these cells. So, in other words, you're gonna get the best out of your fat using this device. And again, this is not me telling this. It's about independent researchers that they took,
Listen,
they
you're
compared
preaching
all
to the
these
choir.
devices and they
I mean,
found it.
Aris, I'm on board, man. I'm all about the lipocube. I've lectured about it all over the world. Hey, I'm going to be in Las Vegas with you at Vegas Cosmetic Surgery, the conference is coming up. And I want to talk to you. Let's remember to talk about the SVF cube and when it's going to be available in the States, because that's my next step. So
It's already available. It has been cleared by FDA. So
well,
that's
congratulations.
we're breaking. Yeah, we're breaking the news now, and I think that's what I was telling you, that hopefully it's going to be the first showcase we're going to do next week in Los Angeles,
Oh,
and
all
then
right. So that'd be the
obviously,
first guy. Good, man.
yeah,
Excellent.
and obviously you're going to get the hold. I think you're going to be one of the first guys in the United States who is going to
Well, we'll be ready to
that.
use it, and I can see using it on faces. I might even use it on the hand, but I can tell you the microfat on the hand has done so well.
And even
All
on
right,
the breast, I mean, you can use it easily for the breast,
to enrich. And then we won't have to. It won't be as good, but we'll be able to do some enriching of the fat grafting.
Exactly. You're going to not get the numbers we're getting with the culture expansion in the lab, but you're going to be better off than doing nothing, just putting the
Right.
fat back to the breast.
Yeah, it'll definitely be better. So, all right. So we talked about fat grafting. Let me ask you: have you tried Alloclay?
That's a beautiful thing. This is what you're having in the United States, and we don't have it in Europe. So I think
Finally, I
you're
got
better off
something you don't
there
have.
for this. You got something we don't have. And we were in Miami a couple of months before, and you presented me this beautiful new tool. And I think this is very interesting. If you can really have off the shelf ready fat, then you don't need to go through liposuction. You can correct some minor deformities with that. But I'll let you talk about it because you have more experience. You have tried it, and hopefully I can get a hold of it next week in Las
I
Vegas.
don't know. Yeah, you might be able to play with it in Las Vegas, but you're probably not going to be able to get it in England, in
No,
Greece, in
this is no,
Brazil.
no, no.
Yeah, you're
We
not
we
going to have
got
it
to
for a
wait.
while. So listen, we're
Yeah,
paying you back for the inability for me to get your enriched stem cell stuff here. So there you go.
let's
Alloclay
wait.
is great. Alloclay is great. I've been very happy with it. We've done a number of cases now, butts, hands. You can use it in the breast. You can use it in the body in different places. It could be used anywhere. And it can be made, it works just like fat. Only, actually, I got to tell you, I think it's a little bit better than fat because for the same volume, we're getting more expansion. It's stiffer than fat. It doesn't compress the same. So if I were going to put in 100 cc's of fat, you wouldn't think you'd get very much. Like if I told you, if I put 50 cc's of fat on each side of the butt, you'd say, why bother? Because it's
Yeah.
so thin, it's so compressible, you're hardly going to see any change. I mean, maybe if you had a little indentation, you want to add 50 cc's around that, maybe you can straighten that out a little bit. We're getting in, what you would think people would go and get a skinny BBL, we're getting incredible results with 100, 150 cc's of Alloclay. I mean, really impressive. Now, we're only a little over 2 months out. We're coming up on 3 months of my experience with Alloclay, but it is not changing. So far, it's very stable. Uh, it's really impressive. So watch out for Alloclay. It's going to be a while before you have it in Europe, but I think you're really going to like it. When we're in Vegas, I want to check this out with you at VCS, and I want to show you
Mhm.
what this thing does. See what you think. I love it.
How about the long-term results? I mean,
Well, this is what
how
we
long
don't know
do you
yet. Right?
anticipate? Okay.
Yeah, this is what we don't know. So theoretically, as you probably know, this is like another product called Renuva. You put the stuff in, it creates this scaffold of fatty tissue,
Scaffold.
and
Hmm.
that fatty tissue then gets incorporated into the body. Your own fat cells will grow in there, take over the tissue, and it becomes your own living tissue. So for long, long term, the anticipation is that it's going to be permanent. A significant percentage of this will be permanent. In fact, a similar product to Alloclay has shown at times, actually, you've shown at times with your stem cell enrichment over 100% take because
Exactly.
it recruits
Exactly.
growth, it recruits other cells, and it expands. So in total volume, you sometimes getting even more than 100%, more than what you placed. This stuff has so much more displacement, so much more rigidity than the natural fat. That's why I think it's better. And I think if the longevity turns out to be what we expect, this thing is a home run. I mean, I told the people that make it, I said, look, if this does what it's supposed to do, and so far it does everything it's supposed to do, if this continues to do what it's supposed to do and it has the duration that we expect, I really do think it's better than fat. And I think it's going to end up being, another boom like Botox. I think everyone is going to start using fat-based fillers, and you're going to stop using some of the shorter-term hyaluronic acids. And I'm just super excited about it. I'm looking forward to, maybe I'm giving away a little bit of a scoop, but we do talk about it. There's a facial version of this product coming out later this year. So I'm really excited about this product.
And then we're talking about regenerative plastic surgery, longevity,
Yeah,
anti-aging,
yeah.
because I think, fat, and adipose derived stem cells and even autoclave, I think can play a huge role in reversing the signs of aging. We had a talk. I just came back from Dubai yesterday, and there was a huge meeting because Dubai is a state of mind. They are innovating, they're trying to get the best possible thing out there. People, they have money, they like to spend money, so they want to give them the best. And it was very interesting because it was a 3 day meeting with lectures from world-renowned plastic surgeons and dermatologists from around the world. And they all stated the same, Adam, that we are getting to the point that using the fat, using the adipose derived stem cells, and using any fat products produced by Lipocube SVF, we are getting to the point that we are reversing the signs of aging. It's not about structural fat grafting. In
Yeah.
other words, it's not about giving volume or projection to the face, to the breast, to the buttocks. It's about really changing in a molecular level
Right.
down to the cellular level the whole way the person is going to age. And I think this
Just
is
making
something
everything
completely
fresher.
new.
Yeah, I mean, true
Exactly.
rejuvenation, true rejuvenation,
Exactly.
not
The
just in
patient
appearance.
comes, exactly. The patient really feels the difference in the quality of the skin, in everything that it's about on the face, the structural changes that happen with aging, they are reversed. And I think this is we're talking about a completely different way of approaching plastic surgery.
Well, we saw that case, the cases that you shared, and what spectacular results. And part of those results were doing what you're calling a scarless mastopexy. So we're talking about lifting the breast with no significant scars, no big incisions, and I know how you're doing it. Let's tell everybody how you do a scarless mastopexy.
Listen, 5, 6 years ago, there were a lovely patient, a very famous actually patient from um, Dubai, that she came. She said, "I'll pay you millions to get me, my breast up there without using any scars." I said, this is almost impossible, but eh, I'll try my best. So we used Renuvian. Renuvian is um, a radio frequency helium plasma based device that basically goes in, shrinks it, like gets the whole tissue by rejuvenating, giving more collagen and elastin, and basically shrinking the whole breast by tiny incisions that we do, three
Right.
tiny incisions, one on the side and two on the areola. So basically, you cannot even see them, after 3 months. And we are approaching the whole breast and we are lifting it using the Renuvian. Now, you can combine an implant afterwards, you can put fat grafting, and we have found also that Renuvian plays a positive reaction on the adipose derived stem cells. In other words,
Right.
uh,
Yeah, I mean, this is actually
wakes
really
up these
exciting, right?
cells. That,
It's part of
that's
what's
that's really
happening.
exciting.
Yeah, it's part of what's happening with your cases. The difficulty of using fat in the breast surgery, as I mentioned before, is getting the fat to do well, getting the highest percentage to take. And what you're talking about, what Dr. Starodimos is explaining, is that he did a study looking at the changes that happen in the tissue and the um, how the fat does after the fat grafts will do after using Renuvion, and it looks like it certainly shows that there's an improvement, there's an advantage to the tissue that's been treated with Renuvion, that the fat graft does better. You get a better take just because you've passed the Renuvion energy through the tissue.
So there are two ways of addressing that. First, we're lifting the breast by Renuvian, and second, pre-treating the breast with Renuvian, you increase the fat grafting survival, which is a home run. It's something that we never knew about that like 5, 6 years ago. So there are some limitations, obviously. So it has to be pressed dosage 1 and 2, meaning the sagging
Right.
cannot be very big.
Yeah, yeah.
And the
Don't
other
listen. Don't
side
get
is
so excited because I don't want to have a deluge of calls
exactly,
tomorrow saying, "Hey, I saw the show. I need a
exactly.
breast lift, but I don't want to have scars. Look, let's do the scarless breast lift." This is not for someone that has real sagging. If the nipple position is below the fold in the breast, if you have true sagging, we can't do scarless. But
You can combine though, and I have
yes,
found this Renuvion, and in a way you can reduce the actual scars that you are going to do with your mastopexy. Meaning, I can use Renuvion and the route block around the areola mastopexy, so breast lift. While if I was not using the Renuvion, I would then end up with the lollipop. Or
right.
in the case of an inverted T mastopexy, I can just do the Renuvion and the lollipop. So whenever patients come, and this, it's obviously the experience that the surgeon has with this procedure, and I know Adam has quite a bit of experience with Renuvion, and he has tried it on the breast. He's going to guide you through the best option, combining Renuvion with, fat grafting, with breast implant, and with the traditional options of mastopexy in order to give you the best long-term results. Again,
Right.
I
Of
would like
course,
to
always
state
looking at
that
choosing the
because
right technique. Yeah,
right techniques and the combination. Now it's not only one technique.
that's
It's
right.
5, 6 different options that you can combine. Where when I was training and you were training, unfortunately we didn't have all these options. And I'm really happy and excited about these times because really
Yeah.
today we can give to our patients many options for the breast.
Yeah, well, they certainly can do things now that 20 plus years ago when you and I just started, they didn't exist, and now we've
Exactly.
we've got a lot that we can do, and you're right, it's about picking and choosing. So just to summarize, the scarless breast lift is a real thing, but it's got to be done for someone that has a minimal amount of sagging. Just it's one of those things where if I see you and we're thinking about doing a breast augmentation, I say, you might need a lift. You might not need a lift. You're right on the line. I've got to see what things look like when we're in there and we get the implant in and see what the skin looks like. Well, now with this technique, I can feel pretty confident about just doing an augmentation, doing the scarless lift using Renuvion, and getting a firmer breast with even a smaller volume of implant and being able to rely on that without having to put more scars on you to do the lift. So we can do a scarless lift, do a breast augmentation, and really help a lot of people with minimal scars. So I think we've kind of gone through the breast. One last thing, surgical lift and augmentation. There's some controversy about whether you should do a lift and augmentation at the same time or stage it. And for the life of me, I don't know why there's any controversy about this anymore. In the beginning, when people started doing lifts and augmentations, it's a complicated operation. It's not for a beginner. And there's a lot of moving pieces. There's a lot of things to consider. And you have to have experience to know how to maneuver around the breast, changing volume, changing the position and the tightness of the breast tissue, whether or not you need to use some mesh, make an internal bra, what you're going to do with the skin. And if you're changing the breast tissue, is that going to give you additional support? I mean, all these things come into play. And because it's so complicated, people had more secondary operations, more revisions that they had to do when people first started doing this operation. So because of that, there was a kind of a shyness to do the mastopexy augmentation. And in fact, Scott Spear, one of the most brilliant breast surgeons that we've had in our time, wrote an article saying surgeons beware. And that was all about everything I just mentioned, all the difficulties in doing a breast lift and augmentation at the same time. But in my mind, we've come such a long way that doing it together, to me, makes the most sense at all. I mean, I'd rather control all those variables at the same time, be able to add the right volume, to alter the amount of lift that I need because I'm adding volume, and vice versa. They'd handle all of that at the same time, then to do what a lot of surgeons have been doing, which is do the lift first, then let them heal and come back and do the augmentation. Or some people are, and I can't imagine why you'd ever want to do this, do an augmentation first and then come back and do the lift. Makes no sense to me at all. So what do you think, Aris?
I mean, I just combine it, do it in one session, but again, it's the preference of the surgeon, it's the experience of the surgeon. But definitely, when you go ahead, and I have done more than 1,500, you know, breast augmentations, combined or not with mastopexy, with Renuvian. So when you have this kind of experience, is easier, Adam. But I can tell you, there are surgeons still today in Europe, in Latin America, and obviously in the United States, that they like to, separate the two procedures. Again, it's the preference of the surgeon. The patient
Sure.
needs to do their homework before they go ahead and they choose their surgeon. And I always like to advise my patients, go out there, see different kind of surgeons, different kind of options, different kind of, you know, procedures that can be offered. Do your homework, and then choose wisely your surgeon. I
So I think you're giving
personally,
a little veiled advice there. I mean, I don't think you want to come out and say, uh, you're not talking about the big pink elephant in the living room, but I think the idea of, well, some surgeons do it in two stages. Maybe you want to look around and see what the options are. You're a very political guy. God bless you. Lord knows I should be more political in the things that come out of my mouth. But the fact is that, look, two operations, two recoveries, two chances for morbidity in each operation. Why? So,
infections,
right,
it's
of
something
course,
that
each
can
time,
be,
each time.
yeah,
Yeah.
exactly.
So
And the
I don't,
cost,
I don't
obviously,
see it. Right, exactly. And the cost of one operation, even though it's a bigger, more expensive operation, is less than the two operations separated out. But look, patient has to have a comfort level. Surgeon has to have a comfort level. There's a place for everything. So I'll say this. If you're comfortable with having one operation instead of two, and you don't mind it being a little bit longer, a little more complicated, there's no guarantee you're not going to have a revision, but the revision rate with an experienced surgeon is very low. So chances are it's just going to be one operation. So in my mind, lift and augmentation, same time, same channel, one operation. So let's get on to the tummy. Uh, there's not that much that we talk about with tummy tucks that is different these days. There's probably the biggest advance in tummy tucks has been the drainless tummy tuck, and it's been controversial. There in the beginning of the drainless tummy tucks, people were using acrylic glue or fibrin glue to try and stick down the abdomen, and that had a huge seroma rate. A seroma is a fluid collection after an operation. So the idea was you'd use this glue, right, and you'd tack it down on the tummy and then take the skin and flap it over, and it would stick the skin back down to the muscle. And that would stop you from collecting fluid afterwards, so you wouldn't need the drains. But it didn't work out that well. It was like 50% or more seromas, like fluid collections, after trying to do this. Now, it's not 100%. So, if I told you, okay, you don't have to have drains right away, but if I flip a coin and catch it, and if it turns up heads, okay, good, no drains. Turns up tails, you're out of luck, kid. We got to go back and put a drain in because you're accumulating too much fluid. Or you got to show up every 2-3 days to the office and I got to take fluid out. That's not a great experience for the patient. So at the end of the day, drains are the biggest problem we have in tummy tucks for patient comfort because they hate them. They're uncomfortable. And so the latest technique is called progressive tension sutures. The idea is that instead of using glue, let's put some stitches, take the skin flap, stitch it down, stitch it down, stitch it down, and then as you're going down, you end up with very little tension at the end of the flap. So when you sew this closed, it heals better, and the skin is stuck down, so there's no room for any fluid to collect. So the seroma rates are very low on this technique. Now, it takes a little longer in the operating room, but what are your thoughts on the drainless tummy tucks?
I think the whole story about the abdominoplasty changed by the time we were trained. We were doing the huge underminings for the whole flap. In other words, trying to raise the whole flap down to the muscular level. And now the lipoabdominoplasty, which is combining liposuction and tummy tuck, is, the way most of the cases, most of the surgeons around the world do it. So when you do lipoabdominoplasty, I think by using the progressive tension sutures saves you a lot. Not only you don't have to use the drains, but you can shape actually the whole tummy in a better way because the vectors that you are using in order to lay down the flap, so in other words, the piece of skin
Where you're
and
putting each of those
subcutaneous
stitches, like the
tissue,
way you put the stitches in. Yeah.
the way you put the stitches gives you a better form and a better vector. It's not only that you're not using the drains, but you are forming a better shape for the whole, abdominal wall. Of course, combining with liposuction. So I
Right.
think it's a huge advancement. And I always say that this is the way to go for all the patients. And I think it makes a huge um, difference for the patient because I remember, the old days, people that were carrying, the drains for like 10, 15 days, and it
Listen,
was
full disclosure,
it
I'm
was a
still using
disaster.
drains. I'm still using drains, and we're
Okay,
just getting started now using the progressive tension sutures to try and
okay,
eliminate the drains. I was not
all right,
impressed with the early results of it, but now it's a real thing. Now the seroma rates are so low that I think it's a worthwhile way to
exactly.
go.
I
Let's talk
mean,
about.
I've been using it for the last 12 years, and
Wow.
because they were called Baruji sutures, so they were invented actually in Rio de Janeiro, Brazil, where I was trained, and I'm still practicing. So for us, it was like a huge difference as opposed what was happening like a couple of years ago. So I think you're on the right track, and you're going to see huge difference. No, a huge difference for your results also. It's not about the drains that the patients they're not going to be using. It's about really shaping
Right.
the and forming the abdomen in a way that it has never been done before.
Well, I look forward to using that more and more. I do a lot of big cases, and there's always a question of I'll people will come to see me. They'll see some of my colleagues. Maybe they come to see you too, and the feedback I get sometimes during consultation is a Doctor So and So, Doctor Smith, Doctor Jones, said that it's too much surgery. I've got to do my tummy tuck first, and then I do my breast surgery, or vice versa. But to do that all in one operation is just too much surgery. What do you think?
I mean, it depends down to every case. There are cases that I'm gonna, say go ahead, you can do. They have no other issue, health issues. They are fit to undergo this kind of surgery. Um, I always calculate how much time I'm gonna need in the operating theater because I
So
think this is a
sorry, Aristotle,
huge.
can you hear me? We're just lost your feed there a little bit. I lost some audio. You okay there?
Can
Just in mine.
can
Okay.
you can you
Sorry,
hear?
we got you back. Yeah,
Okay,
I think it definitely has to do with each individual case. Generally speaking,
exactly,
the idea of a mommy makeover is a really safe combination that, of course,
exactly,
the surgeon has to have the experience, has to know how long it takes him or her to do the operation. I think the longer you're in surgery, certainly you increase potential complications. However,
exactly.
uh, the it's a very mommy makeovers are very safe combos, and
Exactly, and I always, Adam, I always make sure that safety is first. We're not gonna, propose any kind of surgery, any combination, if we're not 100% sure that we can support this kind of. Can you hear me?
doing it at one stage. I think it's not necessary to feel like every case should be separated. I think it's a little too conservative a take. So, what are your thoughts on the mommy makeover in general? We're going to wrap up here, and then finally we're going to get our mommy makeover winner, and we'll introduce her. But what are your final thoughts? Give me your final take, Aris, on the idea of mommy makeovers and making mom look great again.
I think, moms, we have to celebrate them. And, they are going through 9 months, carrying a new life. So the moment they give birth, most of them, they want to look and feel like they were before they got pregnant. So for me, whenever I see a mom walking in our consultation room, I really, want to give all the options, the best options, combining all the available techniques in one stage. So I can give her back in like 15, 20 days, and she can feel and look the way she was just before she got pregnant. And the feeling, the look, the smile we're getting
Yeah.
after we give this to them, I think it's the best present that a plastic surgeon can get. And a happy patient makes a happy surgeon.
Yeah, that is the most fun part of what I do, is that moment that we see them after surgery, taking the dressing down for the first time, seeing their tummy, seeing their breasts. Now, I will say social media steals that thunder a little bit, because we do share a lot of what we do in surgery, and if they watch their surgery while they're in recovery, all right, well, they get a little sneak peek. But it's not the same as when you're standing them up, you take the dressing off and say, wow. And I had that moment just today with a patient that we did a lower body lift on, who'd lost a bunch of weight. He also had some kids. And I'm just looking at, I mean, I was there. I did the operation, and I'm still looking at her saying, oh, my God, this is amazing. Just looking at the shape of her tummy, the flatness, and knowing where she came from. It's really rewarding. That's the best part. So, yes, so by the way, while you were talking about celebrating moms, you're getting like applause back there from the crew. They're standing up, and she's giving you the raise the roof sign right now. So, yeah, see, she says you're her hero. Aris, you're her hero. Another fan for Dr. Sterodemus, as if you needed any more.
Yeah.
All right. Well, I want to take a minute. Aris, stick with us. I want to have you here for the end of the show. But right now it's time. The time has come to celebrate Yo Mama. We had the Yo Mama contest, and everybody that entered submitted a reason why Yo Mama was the best, but there can only be one best. And we went through all the entries and came down to our next guest, who is Amy Seinfeld. Amy, welcome to Naked Beauty. Up, I think. Hold on one second, Amy. We've got it muted. Joe's going to get you on there. We're missing your audio. Are you good? Can we hear you? Can you hearing me?
I can hear you loud and
Now
clear.
we got you. All right, there you go. There's our Yo Mama winner. So we have a nice image up of you with your 3 daughters, and they think you're pretty terrific, and we here at Naked Beauty think you're pretty terrific. We called you yesterday. Joe, you ready to show this? The clip of the call? Okay, Joe's gonna get that together and get it queued up. We had a great moment yesterday where I called you up and you were completely surprised, it seemed like. I don't think they spilled the beans. Anyone let you know that this was coming?
Absolutely not.
Okay.
Completely surprised. I had no idea.
Well, that's great. I'm glad. It was a really special moment. We're just talking about the special moments that we get with patients, and this one was fun because, Dr. Sterodemus is right. Pardon me. The moms that go through so much to bring children into the world, and even the job is not done when that kid is born. I mean, my wife, I think our house would fall down if it were not for my wife taking care of everything, because Lord knows she's got energy of the Energizer Bunny and really makes things run. And when I see the words that came in about you from your daughter, Joe, you ready to roll? I'm going to roll what happened yesterday when we called you to tell you won, and then we're going to read the winning entry. I want you to hear what your daughters said about you.
Hello?
Hi, is this Amy Seinfeld?
Yes?
This is Dr. Adam Rubenstein. I'm a plastic surgeon here in Miami, and I host Naked Beauty Live. It's a monthly podcast, and we did an episode about moms, did a Mother's Day episode. We're doing it, and we held a contest, and I'm not sure if you're aware that your daughters entered you in the contest.
Really?
Yes, this is a
Are
real
you
thing.
sure you have the...
This is a real
Wait a
thing.
minute. This isn't like a crank call.
Your daughters entered you in a contest for people to nominate their moms they thought were fabulous. And we had a bunch of entries, and the entry that your daughters submitted about you won. So you,
Oh my God, are
you
you
are
serious?
the top mama of all the submissions.
Oh my God. Wow, I can't believe that. That's amazing.
Yep. Well,
My kids,
I'll
they
tell
are...
you. All right. Well, there you go. You probably couldn't see it because you're still in the green room. You're on the show and you're not seeing the live feed of the show. But we just showed the clip. I mean, you were there. You know what happened when we called you, and now we got the video because your daughter filmed you. And man, it was fun. It was fun to see your response. I think you were really taken by surprise. But I'm going to surprise you one more time. Here we go. I want you to hear what your daughters said about you. Say, I'm nominating my incredible mother, Amy Seinfeld, for the Mini Mommy Makeover because she is the embodiment of resilience, selflessness, and beauty in every sense of the word. She raised 3 children, including twins, while managing the nonstop demands of running a trauma ER in the tiny town of Huxton. Through sleepless nights, emergencies, and the pressures of being a leader in medicine, she still showed up as the most present, loving, and fierce mom we could ask for. Even now, she continues to pour into others, rescuing animals, staying healthy, supporting everyone around her, yet she never truly takes the time to pour into herself. She's always been the caretaker, the rock, the woman who made everything look effortless, even when we knew it wasn't. She deserves to feel just as beautiful and empowered on the outside as she is within. As her daughter, I've been inspired by her passion, her heart, and her impact. Well, there you
Wow.
go. Pretty wow. So let me tell everybody what you've won. So you have won a treatment with Latibo. Latibo is the newest neurotoxin treatment for relaxing wrinkles. You're going to have the treatments for any wrinkles around the face. We'll do those. You're getting some filler from RHA. It's one of the latest and best fillers on the market of hyaluronic acid filler to help some of the deeper lines and wrinkles in the face. And we're going to freshen up your facial skin with a series of laser treatments called Clear and Brilliant. The Clear and Brilliant laser treatments are a fantastic way to refresh the surface, make your skin look bright. So you just heard what your daughter said. Tell us how it feels to be the winning mama of the Yo Mama contest.
Well, first of all, I want to thank you. This is just unbelievable. I had no idea, and I just couldn't imagine this ever happening. So I really appreciate this opportunity. And it's nice to be appreciated because, yes, I raised 3 girls. And as you know, having children, it's a constant endeavor that that's never ending. And I'm just happy to hear what my kids wrote because it's nice to be appreciated.
Well, it's pretty
Sleepless
special.
nights, working, coming home, dealing with them, ongoing. It's true. I always put myself last. So this is very nice.
She's saying.
Oh,
Pretty awesome. I'm glad you should really enjoy the moment, right? Enjoy the feeling, and well, now you know that your daughters really and truly think the world of you, and it sounds like it's for a very good reason.
yes. And thank you. Thank you for this opportunity. And I'm looking forward to it. I'm excited to come into the office and experience all these products and procedures and see what it's like because I haven't had a makeover.
Well,
So
you're about to have a facial mini mommy makeover, and you can thank your daughters. Actually, you thank yourself for it because it was all the great work you did raising three girls that is now paying back with the entrance into the contest. And girls, Yo Mama won. So we're going to have you in. And we'll make sure that we'll get you schedules. We'll be in touch after the show. We'll get you scheduled to come in, and we'll make sure you're taken care of. Congratulations.
thank you
Well
so
deserved.
much.
All right. Well,
Congratulations.
that's our Mother's Day show. Aris, I don't even know where to begin. You're all over the world. I mean, if you guys have saw the beginning of the show, and we were talking about um, all the different places that I attributed to Dr. Sterodemus, that's not just random things. It's not where he's from. It's like he doesn't have a Qatari mother and a Greek father and an uncle. These are all places where he practices. I mean, he has a practice in, of course, Greece and Athens. He has a practice in Brazil. What city in Brazil?
Rio de Janeiro.
In Rio. Wow, beautiful place. I mean, that's one of the best. And we're in London, right? We're in London in England. You sometimes are seeing patients out in San Diego when you're there with Dr. Cohen.
And Los
And actually,
Angeles,
also,
yes.
you're also are you in Boston as well? Where else do you see patients in the United States?
Yes, I do see patients in New York and Boston.
New York and Boston, so a few locations in the United States. In Dubai, you have a clinic that you work through. And most recently, and congratulations on this, now up and running, the new hospital, the new aesthetic hospital in Qatar. And
In Doha,
very exciting.
Qatar, and we're gonna have you on board. I mean, Adam Rubinstein is our new addition because I really am looking for people and professionals that they are really on the top edge of our professions. So Adam is going to be joining us, and hopefully in June he's going to be in Doha, Qatar, to see some of the Qatari patients and Saudi Arabians also, and he's going to give his beautiful, insights for mommy makeover, facial rejuvenation, and hands. I mean, Adam is
That's
doing a
it.
great job in the hands using the Renevian, combining some fat grafting there.
And
Really,
the
you are
lipocube.
rejuvenating the skins and the lipocube. So I
Yeah.
think, again, congratulations. You are one of the main plastic surgeons in the United States right now, bringing all the cutting edge techniques and technology back home for your patients.
Well, I'm trying to keep up with you, man. Whenever I meet with you, I bring stuff home that is a new thought that I haven't tried yet. And I will see you in Las Vegas. If people want to have have a consultation with you, Dr. Sterodemus, what is the best way? And I know you're all over the world. I mean, patients seeing this all over the world may have an interest. What is the most central
Uh,
way? One
uh,
place.
uh, I mean, but they can go on the website www.sterodemas.com, and they can use the Instagram aris_sterodemas, and they can DM us. And also, there is a portal for the Surgery Art Hospital in Qatar. They can type
Perfect.
www.surgeryart.hospital, and they can schedule a consultation or an expert opinion. We get a lot of online consultations for expert opinion. And obviously,
Right.
if the patients cannot come and have surgeries with us, we can guide them through excellent professionals in their home countries.
Right. Yeah. Well, and being so involved in the international community, uh, both of us, especially you, that have been so involved with the international societies, we know so many people around the world, and I do the same thing. If someone
Yeah.
can't come see me, that we've done a consultation for, and people actually will ask. I can't. I get a lot of requests from the Middle East, so maybe now with the hospital in Qatar, we'll be able to take care of some of these people. But uh, I, I can't thank you enough, my good friend. I know it's the middle of the night there. You've given your sleep to help to being
It's
on the show.
it's already 2 a.m. and I got an early 6 a.m. surgery
Ah,
list to
well,
do
I'm going to
tomorrow.
let
But
you get your rest.
for you, no, for you, my friend, I'll do anything. And thank you very much for having me. It's And looking forward to seeing you in Las Vegas in next week. Take care.
Yes,
Thank
I
you.
look forward to that. Dr. Aristodemus, plastic surgeon extraordinaire all over the world and famous inventor of new techniques and technology, my good friend, thank you. Thank you. So that's our show today. Now, we have another great show coming up in June. We're already making great plans. Not going to spill any beans yet, but we have a great show. We did a mommy makeover show just now. This was our month of May show because for Mother's Day, we celebrated the moms. What about the dads? We got to do something for the dads. So June is a man's show. It's going to be a male-oriented show celebrating the fathers all over the world. So happy Mother's Day in May. Happy Father's Day in June. Thank you for joining us on Naked Beauty Live. I hope you enjoyed the show. We will see you in June with the Daddy Do-Over show. How about that?